Atrophic rhinitis is a chronic nasal disease, characterized by a progressive atrophy of nasal mucosa, atrophy of turbinate bones, a formation of thick, dry, foul-smelling crusts, a paradoxical nasal obstruction, despite wide nasal cavity, also known as ozena, when foul smell is prominent. Types: 1. Primary atrophic rhinitis, idiopathic, a common in tropical countries, India, a more common in young females, are usually bilateral. 2. Secondary atrophic rhinitis, occurs due to a excessive turbinate surgery, SMR, turbinectomy, a chronic granulomatous infections, a syphilis, a tuberculosis, a leprosy, a radiotherapy, a long-standing sinusitis, etiopathogenesis, multifactorial. 1. Infection, a Klebsiella ozeni, most important organism, causes chronic inflammation, mucosal damage. 2. Vascular theory, endarteritis obliterans, a blood supply mucosal atrophy. 3. Hormonal theory, a common in young females, worsens during puberty and menstruation. 4. Nutritional deficiency, a iron deficiency anemia, a vitamin A deficiency. 5. Autonomic imbalance, a sympathetic overactivity dryness. Pathology or histopathology, mucosa, a squamous metaplasia of respiratory epithelium, a loss of cilia, a atrophy of seromucous glands, submucosa, a fibrosis, a endarteritis obliterans, bone, a atrophy of turbinate bones. Clinical features. Symptoms: patient complains. 1. Foul-smelling nasal discharge, patient usually unaware merciful anosmia. 2. Crusting in nose. 3. Nasal obstruction, paradoxical. 4. Anosmia hyposmia. 5. Epistaxis, on crust removal. 6. Headache. 7. Social embarrassment, others notice smell. Signs, on examination: a wide roomy nasal cavity, atrophied inferior and middle turbinates, a greenish-yellow dry crusts, a bleeding on crust removal, a dry, pale mucosa, a foul smell from crusts, black right arrow hash posterior rhinoscopy, a crusts extending to nasopharynx.
Characteristic features: paradoxical nasal obstruction, foul smell noticed by others, wide nasal cavity, merciful anosmia, Klebsiella ozeni. The diagnosis: primarily clinical investigations, nasal swab culture, Klebsiella ozeni, HB level anemia, CTPNS shows wide nasal cavity, turbinate atrophy. Management: medical management mainstay: 1. Nasal toileting, alkaline nasal douching, sodium bicarbonate plus sodium chloride. 2. Crust removal, under endoscopic guidance. 3. Local medications, 25% glucose in glycerin, liquid paraffin nasal drops, antibiotic ointment. 4. Antibiotics, according to culture, commonly streptomycin, ciprofloxacin. 5. General measures: treat anemia, improve nutrition, vitamin A and iron supplementation. Surgical procedures: 1. Young's operation, most important, closure of nostrils temporarily to permanently. 2. Modified Young's operation. 3. Submucosal implants, Teflon, a cartilage, a bone.
Complications: septal perforation, chronic pharyngitis, laryngitis sicca, social isolation,